Hi, my name is Peyton Awaya, and this is my nursing scenario 1 on the non-dilating patient requiring a C-section. I can't believe this is happening. I really wanted to have a natural birth. Hi, my name's Peyton, and I'm going to be your nurse today. I want to take a moment for you to just breathe. I can see how heavy this is weighing on you, and I want to validate exactly what you're feeling. You've been working so incredibly hard for the last few hours, physically and mentally. It's completely normal to feel a deep sense of loss right now. When you envision a specific birth plan for so long, and suddenly that path changes, it can be a big shock. You're grieving the experience that you thought you were going to have, and that's 100% normal and okay. I also want you to know that needing a C-section does not mean that your body failed you, and it certainly does not mean that you failed as a mother. Sometimes, even though our best efforts, labor just takes a path that we didn't expect. But please don't feel like you need to be brave or hold it together at all right now. It's okay to cry, and it's okay to feel disappointed or even angry that things aren't going the way that we had once hoped or planned for them to go. But just because the method of delivery is changing doesn't mean that your efforts weren't enough. It also doesn't mean that the birth won't still be beautiful. For right now, though, it's okay to just sit with that disappointment. I'm here with you, and we're going to navigate this change of plans together one step at a time. For example, in a little, we can talk about having skin-to-skin contact in the operating room and having your partner right there by your head. For this moment, though, it's okay to just feel sad about this change. I'm here to be your advocate and your supporter and help you through this. Why do I have to have a C-section? Is something wrong with my baby? That is the most important question to ask, so let me be very clear with you when I say that the baby is safe. The sound that you hear on the monitor is a strong and steady heartbeat, and the jagged raises on the lines that we see are what we call accelerations. Accelerations are there to help show us that the baby has good oxygen reserves and that the baby is handling the stress of labor very well. We're not rushing back there because the baby's in trouble. We're trying to go back there to prevent the baby from getting into trouble later on. To be more specific with you, the reason why your doctor is recommending the C-section is because even though you've had strong contractions and you've been doing amazing with the labor, your cervix has stopped dilating. Essentially, when your cervix stops dilating, it means that the baby cannot come out safely. This could be for a couple of reasons, such as a size mismatch or even an alignment issue between the baby and your pelvic region. But if we keep waiting and pushing against a cervix that won't open, the uterus could get overwhelmingly tired. That just puts at risk for infection and even stress on the baby. We want to move to a C-section now, while you and the baby are both healthy and strong, rather than waiting until it becomes an emergency situation. Does that help explain the situation a little better? I'm scared and disappointed. I appreciate you being so honest with me. It's completely normal to be scared. A C-section is a major abdominal surgery, and walking into an operating room when you aren't expecting to is overwhelming, especially when it's something that you didn't initially plan for. I want to take a minute to explain the room for you so that it's not as scary when we wheel you back. The room is going to be bright and cool. We keep it cold to keep the infection risk low. Also, you'll see a lot of people in masks and gowns, but just remember, every single person in that room is there for you and your baby. You'll have an anesthesia provider at the head of your bed the whole time. They aren't looking at the surgery, they're looking at you. They want to monitor your comfort and your breathing. I will be there as your nurse, moving around the room to make sure that everything is safe. Your support person will be seated right next to you, holding your hand. We can also put a drape up so that you don't have to see the surgery, but we can lower a clear drape when the baby is born so that you can see them immediately. Like I mentioned before, we can also discuss having skin-to-skin contact with you and the baby after birth. Regardless, I promise we are going to take excellent care of you. What if something goes wrong in surgery? What can go wrong in surgery? It's very smart to ask about the risks. I know that feeling like you don't know enough can make the situation a lot more intimidating and stressful. I want you to feel fully informed so that you can give consent with confidence. While a C-section is very common and generally a safe procedure, it's still a surgery, and I want to assure you that we take it very, very seriously. The primary risks that we monitor for are hemorrhage, which is bleeding more than normal, infection, either in the uterus or at the skin incision, and rarely accidental injury to nearby organs such as the bladder or the bowel. I'm going to tell you how we prevent these things. Starting off with infection, I'm going to give you a dose of IV antibiotics before we wheel you back. That way, your body is fighting off anything that might even try to infect you. For bleeding, we've already sent your blood type to the lab just in case, and we're going to give you medication immediately after the baby's out to help your uterus clamp down and stop bleeding. For organ safety, you're going to have a Foley catheter in your bladder. This will help drain your bladder to keep it small and out of the surgeon's way so that you don't have to worry about the surgeon accidentally hitting it or injuring anything like that. We have a checklist to follow to ensure that every safety measure is in place. We're prepared for the risks so that we can keep them from becoming problems. I can assure you that you are in great hands. Will I have to have C-sections for the rest of my life? This is one of the most common questions that we get. The short answer is no, not necessarily. It fully just depends on how the surgeon cuts the uterus today. There are 2 incisions, one of which goes on your skin. Usually this is horizontal, and the other one goes on the uterus itself to get the baby out. Most of the time, the doctor will make a low transverse incision on the uterus. This heals very strongly. If you want to talk to the doctor about your incision options, we can also do that. But I can tell you that if you have a low transverse incision today and your next pregnancy is normal, you'll likely be a candidate for what we call a VBAC. This is a vaginal birth after cesarean, which essentially is just saying that you are still a candidate to have a baby vaginally after you have a C-section. You won't have to have C-sections for the rest of your life. After the surgery, I'll check the operative report and confirm exactly what type of incision you had so that you know for the future. But I also want to clarify again that our main goal today is to focus on you and the baby and to ensure that you have a healthy and successful delivery. What will the scar be like? How do I take care of it? I get keloids. Thank you so much for telling me about the keloids. The keloids are vital information for us to have on record. I'm going to make a note of that in your chart right now, but I'll also verbally tell the surgeon before they close the skin. Sometimes knowing this will allow them to use a specific suture technique or closure method on the scar line to help minimize tension on the skin. The incision is usually made just above the pubic hairline. You might have heard this referred to as the bikini cut. It's very low and it's easily hidden by underwear or a bikini. Regarding care, the main thing you want to do is keep it dry. Bacteria love moisture, and this can also cause a breeding ground for infection. When you shower, you can let the soapy water run over it, but do not scrub it. And afterwards, you want to pat it completely dry with a small, clean towel. You don't want to scrub or irritate the skin in any way. Next, you want to monitor it. You want to look for signs of infection. This could be redness, swelling. Redness could also be spreading. There could be heat. There could be oozing pus. There could also be a foul smell or an odor. For keloid care, since you just shared that you're prone to keloids, once this incision has fully healed, and this is usually around the 6-week checkup, you can talk to your doctor about using different silicone scar sheets or topical gels or anything else that you might be interested in doing, which have been proven to help flatten scars and reduce keloid formation. For now, just focus on your baby. We will handle the incision care while you're here, and we will remind you what to do before you go home. We can also provide you with written resources so that you feel best prepared for your recovery process. Do you have any other questions before I go get the teams called and started? Thank you so much for allowing me to be your nurse today and for letting me help you through this journey. It's truly a blessing to be able to have a baby, and I'm so happy that I can be there for you and for this experience. And once again, I just want to remind you that I am here as your nurse and your support person and your advocate. Any questions that you have, I'll be happy to answer, and if I don't know them, I will be happy to find you the answer or refer you to someone that does. please, please, please just know that we are here for you, and our main goal is to make sure that you and the baby are safe and healthy. Thank you.